I am going to start right now. So what am I talking about today? Number one, of course, as you can see, the topic is brain fog, and probably that is why most of you registered for this, because brain fog is something that has become very common recently. So how this will go is, first of all, I will share a little bit about my vision of brain health and what I'd like to do in this in the field of brain fitness and brain health and brain assessment, because I don't think I have really shared my my big picture, so to say, about what I want to do, because this year I've decided that 2022 is going to be the year of the brain, and not just 2022, it will be moving forward beyond 2022 as well. So I will briefly talk about what is brain fog, obviously, and what are the possible causes. But more importantly, I want to focus more on the solutions. And as you will realize, the solutions are different for different people. And feel free to ask any questions in the chat box or the Q&A, even while I am speaking, in case something just comes to your mind. If you want to type something right away, because I want to make this time valuable for you, so that I know what it is you're looking for, and hopefully I will be able to provide you with some answers. After the webinar, what will happen is, maybe by the end of today or tomorrow, you will receive a PDF of, it's a short, very short ebook on brain fog, and most importantly, a few of the strategies. And again, this is not going to be in details or anything, but that might, encourage you to ask more questions and, you know, find out whether there are any of those factors that are impacting you. And today I don't have slides, because I decided that slides are not necessary, because I'm going to send you a PDF, and the PDF basically includes the stuff that I'm going to talk about. I am Dr. Shabnam Das Kar. I'm a functional medicine doctor. I live in Alberta in Canada, and I was an OBGY in Mumbai for many years before I moved to Canada. And I loved what I did back then. But after I did a fellowship on functional and metabolic medicine from the American Academy of Anti-Aging Medicine, I have transitioned completely into functional medicine now. So the last babies I delivered and the surgeries I did were way back in 2013. It sounds like a long time ago. And why did I decide to focus on the brain? Because most of the time, and that includes me as well, I never assessed my patient's brain health. Even today, I'm still looking for an easy and simple way to do a complete brain assessment. And why is brain health important? Because your brain decides everything about your life. Whether it is your relationships, it's how well you do at your work, or if you're in school, how well you do in school, how well you function overall. Everything is decided by your brain. And another question I get asked sometimes is, when is the right time to start thinking about the brain and working on improving the function? It is anytime. It's never too late, and it's never too early. And all of us know that the number of people living with dementia today, it's just rising dramatically. Of course, age is one of the factors, because people are living much longer than ever before. But is it only age, or are there many other factors which are important when it comes to brain health, and not just dementia? So Alzheimer's disease is the commonest dementia, but there are other dementias as well. And as you probably know, there are no treatments, curative treatments for dementias like Alzheimer's today. Billions and billions of dollars have been spent on trying to find a cure for Alzheimer's, but that hasn't shown up yet. Yes, there are some medications which can help manage symptoms, but it's not a cure. And I do hope very soon we find something. But at the same time, because many of you may have loved ones who are going through all these cognitive challenges, or you're taking care of someone with Alzheimer's, definitely I mean, I can't even imagine what you're going through, because I have not done that. but it is very hard. And I know, I mean, though my father did not have Alzheimer's, he had terrible anxiety after my mother passed away. And it was very painful to see my fully functional father suddenly become like completely paralyzed. He was very anxious. And anyway, that was a long time ago, but I can understand how terrible it feels to take care of someone who was absolutely fine. And and then suddenly over a period of years or months, it's seeing them deteriorate like that. It's very painful, I know. So going back to my focus on brain health, and I have already given the bad news that there is no curative treatment for Alzheimer's yet. But this is I want to give a message of hope. What we do know is Alzheimer's doesn't suddenly develop when you are 50, 60 years old or even older. And the other important thing to remember is dementias like Alzheimer's are not a normal part of aging. Everyone who is 80 or 90 years old or 60, 70, whatever age you might think of, it's not like inevitable that you're going to develop cognitive decline. So that is what, as a functional medicine doctor, it excites me, because Alzheimer's starts 20 to 30 years before someone actually develops symptoms. Now, that 20 to 30 years, for me, that is a period of opportunity. So those 20 to 30 years, there are a lot of things we can do which can help you reduce your risk for dementia down the line. But very often when we are in our 30s, 20s, 30s, or even older, and we are not experiencing some dramatic changes in our own cognition, we think, oh, that's something that is not going to happen to me. So we do have cognitive dissonance, and there are studies supporting that. When we read about anything that, let us say, a certain percentage of people are going to get dementia in later life, we always think that we are in the other percentage, the ones who won't get dementia. But my point is, it's not just dementia in old age, it's also improving your focus today, getting rid of brain fog. That is something so important, and there are so many things you can do. So my goal at every webinar is, number one, to give you information, of course, but at the same time, I want you to go away with things that you can implement for yourself. Some of the things you do need the help of someone who is either your doctor or any other healthcare practitioner who can help you, because most of the time information is not good enough, because you need to know what is right for you, what is appropriate for you. So if you have any questions, feel free to type right away, so that I want to make sure that I'm addressing those. Otherwise, I'm going to continue with, so what is brain fog? And brain fog is basically how patients have described to me, is basically, doctor, I don't feel my brain is as sharp as it was before. I feel my thoughts are going through jello or treacle, and depending on where in the world you are, I feel my thoughts are going through a thick liquid. I have to push myself to get my work done, or I don't feel as sharp. And some people, particularly middle-aged women, have asked me, do you think I'm getting Alzheimer's, or I will get Alzheimer's down the line? Now, the fact is, not all of these symptoms will mean that you're going to get Alzheimer's down the line. But at the same time, in medicine, brain fog is not really recognized as an entity as such. And this has come from people describing how they felt, and then finally doctors realized, okay, this is something we need to address. So what are the possible conditions where people have talked about brain fog? Now, given the ongoing coronavirus pandemic, many people have experienced what is called long COVID. So long COVID is basically a bunch of symptoms. And yesterday I realized, I knew that there were 200 different symptoms of long COVID. Yesterday, I realized the list is getting longer. There were like 204 symptoms. And the commonest symptom people talk about is brain fog and fatigue. So as a part of long COVID, you may be experiencing brain fog. And the fact is, long COVID is something that people who have even had mild disease. Like they were not in the ICU. Many of them didn't even need admission into the hospital when they had a coronavirus infection. But 2 months, 3 months down the line, they did not feel as good. Now, I'm not talking about long COVID today because there are so many different symptoms, but brain fog may be a part of long COVID. And unfortunately, now long COVID finally has a medical term. It is called post-acute sequela of SARS-CoV-2 infection. So PASC is the acronym for it. Because at the beginning, when we still don't know a lot about the SARS-CoV-2 infection, but at the beginning, when people said, okay, I don't feel as good. I've had the acute infection. I no longer have the coronavirus infection. I am no longer, infectious anymore, but I don't feel good. My brain doesn't feel good. I'm not able to perform and work the way I should. I was able to do before this, but many of them were told, oh, you are fit to go to work. And they said, I don't feel that well. And unfortunately, many people experienced, unfortunate, unpleasant experiences from their doctors, because the doctor said, oh, you are okay. It's the acute infection is gone, and, you don't have to worry about anything. And some of them were told, oh, it's all, you are imagining it. There can't be anything wrong with you this way. But fortunately, and I think to a great extent, we should thank technology, because thanks to modern technology, patients decided to take it up. And in the UK, there is a very big group, and they have collaborated with universities. So it's not only patients who are, doing it, because they obviously need the academic, scientists helping them. So this is, again, patients said, no, we are not feeling okay. And you can't just dismiss us off saying that, it's not true, it doesn't exist, none of that. So that has changed, which is very good news. And that has changed in a very short span of time. Anyway, going back to brain fog as a part of COVID-19. Now, obviously, as a part of long COVID, most people don't experience just one symptom. So brain fog could be a part of many other symptoms. Some of the other symptoms could be shortness of breath, palpitations, fatigue, as I mentioned earlier. A whole lot of symptoms are there, which can be a part of, like I said, 204 different symptoms. So my point is, you may not feel only one symptom of brain fog. And with long COVID, what we are also finding out is people don't feel the same symptoms every day. So if you have experienced brain fog today, tomorrow you may feel that you have palpitations as well, along with brain fog. And these variable symptoms are also not something that, because most of the time we are used to a disease condition having a set of symptoms and they usually continue the same way. But with long COVID, that is not true. So that was probably another reason why doctors said, oh, you can't be having one symptom today and a different symptom tomorrow. So, as doctors, there's a lot we have to learn. But anyway, so that is long COVID, one of the reasons for brain fog. Another important one is autoimmune conditions. So there are 80 to 100 different autoimmune conditions. And some of the commoner ones are things like multiple sclerosis, rheumatoid arthritis, lupus. Actually, all the autoimmune conditions may be related to brain fog, and you may have more than one. Even a Hashimoto's thyroiditis, which is a hypothyroidism because of autoimmune destruction of the thyroid gland, that can also give you brain fog. And sometimes that can be hypothyroidism may not have been optimally corrected. So autoimmune conditions are one of the main reasons. And so the long COVID and brain fog, this is not actually uncommon in the sense that after viral infections, many people have experienced this in the past as well. So and the coronavirus infection is a viral infection. So it can happen after viral infections as well. Brain fog can happen even after bacterial infections. So years ago, there was this problem of, I think it was somewhere in Ontario, where the water was contaminated by, some bacteria. Normally in countries like in first world countries, waterborne diseases are not common. I come from India where waterborne diseases are still common. So what ended up happening is the water got contaminated, and unfortunately, this was years ago, it was in the 90s, one elderly person died from diarrhea and all these, waterborne stuff. But there were a lot of people who got infected by that water, and they were cured. But many months down the line, many of them went back to the doctor saying, "Doctor, my brain does not feel the same." And back then, a lot of it we didn't know as well. Yes, Hashimoto's, definitely. I'll come to your this thing about Hashimoto's. I'm going to look at your comment and question in just, I'll just finish this sentence. Sorry, I got distracted with the chat. So what they found is many of these people who had the gut infection from the water contamination, they felt, mood issues, anxiety, depression, all these things, which were, most of them were, they found that it was related to that acute infection they had. So the point is, you may have had an acute infection when you went visiting some country where the water is not as good, and afterwards you come and feel that your brain is not working as well, you're experiencing brain fog. So there are reasons. It's not all, oh, you just don't know what's going on with you. So that is about infections. Another important area is nutrient depletions. So nutrient depletions are things like iron deficiency, vitamin B12 deficiency, all the B complex deficiencies, magnesium, vitamin D. So these are some of the major ones. And as I have mentioned earlier in other webinars, in my opinion, nutrient deficiencies are easier to deal with, because something like iron deficiency is so common amongst women as well as men that is relatively easier to correct. And it's not right that you should feel, brain fog and not feel your best because of some nutrient deficiencies, because they can be corrected way easier than some of the other conditions, like, and then there are some other ones which are, for example, stealth infections or mold infections, or Lyme disease. Those are also some of the reasons. And like I said, it depends. Each person is different. So nutrient deficiencies, autoimmune conditions, long COVID. Then another important factor is what we used to call, and I guess it is still called, mommy brain. So after a woman delivers, there are a lot of hormonal changes that happen. And some women also develop postpartum depression. And my son is 27, but I still remember my mommy brain after so many years. There were times when I used to think, like, is this like sort of permanent? Is this how my brain's going to feel forever? But anyway, it didn't. So obviously, if you are experiencing brain fog, you definitely wonder, is this a permanent thing? Is this something that's going to worsen over time? Again, it would depend on why you're experiencing brain fog. Sometimes we can't even pinpoint the reason always, but making certain changes and I'm going to talk about those, can help you to a great extent. And before I go to your question about thyroid, the other thing I wanted to mention is hormonal imbalance. So women going through the perimenopause, menopausal stage, hypothyroidism, these can also cause brain fog. And in men, low testosterone is related not only to metabolism, but also to their, it is related to brain function as well, mood issues. So sometimes brain fog can be a part of, depression, anxiety, or any of the mood issues that you may be experiencing. So those are the commonest reasons. Then there are the more not as common, but again, it depends on what is going on with you. So another major reason could be obstructive sleep apnea, and I'm not going to talk about that today. But when I talk about sleep, so obstructive sleep apnea is a condition where you stop breathing when you're asleep, and you will need to get a sleep study done to find out whether that is a problem for you. So I'm going to go to your question now. So yes, when your TSH spiked due to not taking levothyroxine regularly, I was experiencing a lot of the mentioned symptoms. Okay, so that is, and I don't think all of you can read her comments or questions. So what is going to happen is I can actually unmute you if you want to ask or you want to add your comments as an audio, but you will not be seen. But if it is okay, so the comment was, when my TSH spiked due to not taking levothyroxine regularly, I was experiencing a lot of the mentioned symptoms. Now I take it exactly same time on empty stomach. TSH now is at its lowest. That is wonderful that you figured out what was the problem for you and you found the solution. Yes, hypothyroidism. So levothyroxine is the thyroid hormone, the T4, that is used to treat hypothyroidism. And Hashimoto's is the commonest form of hypothyroidism, where your thyroid gland is destroyed by your own immune system. And why does that happen? We don't always know the exact reasons, but sometimes it could be a bacterial infection, it could be medications, it could be some food or food additives which can trigger that. So though we don't know the exact reason, any autoimmune condition is usually triggered by something else. One more factor that I wanted to mention about brain fog was, of course, I'm sure you already guessed that I would go to food finally. So lifestyle changes, and if you've heard me speak before, I always talk about SEMMT. So sleep, eat, move, mind-body interventions, and therapeutic supplementation. So SEMMT, all of them are equally important for brain fog. Now, when it comes to food and brain fog, many of you have food sensitivities. And what is food sensitivity? Basically, it is not the same as food allergy. So food allergy is, for example, peanut allergy or nut allergy or shellfish allergy, where you when you are exposed to any of those, you have an immediate reaction, and many a time you need to go to the emergency room directly soon, and it's a serious emergency, or you're someone who carries an EpiPen with you. That is food allergy, and that is a different acute problem, severe symptoms, need emergency care right away. But what I'm talking about is food sensitivity. So what people have experienced is, when they eat certain food, which is absolutely healthy for other people, but let us say you have a sensitivity to gluten. Why do I bring up gluten? Because that's one of the commonest food sensitivities. So when you eat gluten containing food, what happens is you experience brain fog. Now, brain fog could be one of the symptoms. Some people experience bloating, some people experience joint pain and skin rash and headache. So the symptoms are not necessarily related to the gut, but the symptoms could be anything from, like I said, mood issues, brain fog, all those things. So that, for the treatment for that is for you to do an elimination diet. So you basically eliminate the commonest food sensitivities are gluten, dairy, soy, corn, sugar, and processed carbohydrates and grains. So these are the commoner ones. Then, of course, we have some patients who are sensitive to things like carrots or tomatoes. So you would think that carrots and tomatoes are healthy vegetables, but it may not be healthy for all. So you eliminate the common food for 2 weeks, and then you reintroduce them one by one. Now, when you've heard me speak before, gluten is not something I ever recommend you reintroduce, particularly if you have an autoimmune condition. So one is food sensitivity. Another factor which can give you brain fog is eating too much of carbohydrates. And last month's webinar, I talked about relative hypoglycemia or reactive hypoglycemia. So what does that mean? What happens is, when you eat more of carbohydrate containing food, so things like rice, pasta, the Indian flatbread, that's the roti, or pizzas, burgers, or even if you are cooking pasta and things like that at home, starchy food, they contain a lot of carbohydrates. And if you're not eating, particularly if you're not eating enough protein and good fat with that, So you've heard me speak before. I always talk about prioritizing protein. So if you eat more of carbohydrates and less of good quality protein and fat, what happens is carbohydrates can raise your blood glucose levels very high, and then they fall dramatically. Now, in last month's webinar, I said if there's just one slide you want to see, that is the one you need to remember, what carbohydrates do to your blood glucose levels. So when that, you're on the carb roller coaster ride, what happens is as the blood glucose levels fall, you can experience a lot of brain fog. And some of my friends describe that as the carb haze. Your brain is like going through this haze because of the excessive amount of carbohydrates you've eaten at the last meal. Now, what is excessive? It's different for each person. If you are someone who's already eating very low carbohydrate in your food, maybe what you do need to look at is, are you eating enough protein? Because as I always say, it's not enough to just take away and take away and take away stuff from your food. You need to prioritize the right nutrients for your brain. And when we talk about brain fog, I have talked about this before. Our brains are just 2% of our body weight, but our brains use up 20% of our energy requirement. So are your brains getting adequate nutrition? And what is really good for the brain? Yes, if you just Google for brain healthy food, you will come across a fatty fish and blueberries and I don't know what else. The thing is, it's not just fatty fish and blueberries. Fatty fish, people will talk about fatty fish containing omega-3s. Yes, omega-3s are extremely important for your brain to function because all of us have fat heads. And the brain is very rich in one omega-3 called DHA. So the other question comes, can you get enough from only food? And for most people, even if you eat fish regularly, and the standard recommendation in Canada is 2 servings of fatty fish a week because of all the toxins like mercury in the fish. Eating 2 servings of fish in a week is not going to give you enough omega-3. So that is where the supplementation comes. So talking about high carbohydrate food and relative hypoglycemia and reactive hypoglycemia, if you find yourself as someone you have your breakfast or your lunch, and 2 hours after that, you feel like, as some of my patients, I have described that before as hangry. You're angry and hungry at the same time. So what can you do in such a situation? Try eating more protein at the previous meal and see how you do, and add good quality fat. So good quality fat like things like olive oil, avocado, nuts, and good quality protein would depend on what you eat, whatever your favorite protein is. Now, this is where it becomes a little bit of a challenge for people who are vegetarian or vegan. And I have a lot of patients in India who are vegetarian. And Indian vegetarian food is severely dominated by grains. Now, grains contain a lot of carbohydrates. And what another favorite source of protein, which my vegetarian patients think they're getting a lot of, is beans and lentils. Now, unfortunately, some of you have very low carbohydrate tolerance, and beans and lentils do contain a lot of carbohydrates in them. So bottom line is, if you are vegetarian or vegan, you will need to add a protein supplement. And these are strong words, you will need to add, because I have tried figuring out if someone can get adequate protein from only food. And my wonderful associate, Mikhail Offer, whom many of you have seen on my webinars before, she and I have discussed how it is absolutely impossible for someone to get adequate protein from vegetarian sources or vegan sources and not get the carbohydrates. So it would depend on what your carbohydrate tolerance is. It depends on your physical activity. Some of you manage your carbohydrate intolerance very well because you're extremely active physically. You go to the gym, you're walking regularly, you don't sit continuously. So like I said, it's different things for different people, but prioritizing protein is important. So that is when it comes to food. So food sensitivity and not eating a lot of carbohydrates are 2 major ones. Then I said, I'm going to talk about some solutions. So here I'm going to pause for a few seconds. If you have any questions, feel free to Either you can actually use it, either raise your hand and I'll unmute you, or you can add in the Q&A box. In the Q&A box, others can read it, but I think I changed something in the settings on my chat where rest of you can't see what is there in the chat box. It's only me who can read that. I should change that maybe. So feel free to raise your hand or type in the Q&A box so that everyone else can read it. Otherwise, I will read it out. I want to maintain your privacy, so I don't mention your names, but because I haven't even asked you all ahead of time whether it's okay. So while I get a sip of water, and by the way, dehydration is one of the relatively easier way to correct brain function. Sometimes you can feel terrible when you're dehydrated and not even know it. And this is a serious problem for many older people, because one is they may forget to drink water, and the other thing is they may think that, okay, I have disabilities, it's a challenge going to the washroom, so I'm not going to drink a lot of water. But your brain can shrink and that can cause problems. So dehydration is another big one. Okay, I don't see any questions right now. So I'm going to go on with the next part, which is solutions. So I've already talked about protein, prioritizing protein and food sensitivities. So as you know, I'll always talk about food. Another factor is sleep. So if you don't sleep well, so when it comes to sleep, there are different problems. One is people who don't prioritize sleep. You don't think sleep is important, you're overscheduled. As some people say, I'll sleep when I die. So you are someone who doesn't prioritize sleep, who doesn't think sleep is important enough, or your schedule is so busy that you don't have enough time to sleep. That is a different problem compared to, there are a lot of people, and particularly women going through menopause. Men have this challenge as well. It's not just exclusive to women, but you're going through menopause and you have what is called chronic insomnia. So chronic insomnia is the difficulty in falling or staying asleep despite giving yourself the opportunity to sleep. So, and I had experienced chronic insomnia, so I know how horrible it is and the things that we do. So it would be 10 o'clock, I'd look at the clock, oh, it's time for me to go to bed. And I wouldn't be, sleepy, but I would hit the bed and then stay wide awake in bed, not counting sheep, reading books. And that was not something that was helping me at all. So after I solved my problem, and I'll tell you how I solved that, I decided this message needs to go across, because if you read stuff on the internet, most of the time, what are the solutions you are given for good sleep? Oh, you need to reduce your daylight exposure, in the evening, or in artificial light exposure in the evening. Yes, of course, that is very important. You need to get, exposure to morning sunlight. You need to have your, coffee or tea on the deck in the morning. Okay, good if you have an option, but some people don't have an option. And in winter, what do you do? So that is another one. Oh, you need to darken your room. Your bedroom should be like a cold, dark cave. Temperature should be, between 18 and 19 degrees centigrade. And you need a mattress cooler, and you need to stop your caffeine. All those techniques are very good for someone who does not prioritize sleep. So those are called sleep hygiene techniques. Most of them will not help you if you have chronic insomnia. So I'm going to say that again. If you have chronic insomnia, you have difficulty falling or staying asleep, or you wake up several times at night, and it's not always to go to the bathroom. You have chronic insomnia, and stopping caffeine, daylight, because I have done all of that. And what ends up happening is you feel like, what is wrong with me? Why can't I fix my sleep? And I used to tell my colleague, Dr. Iyer, I said, Natasha, both of us are functional medicine doctors. Why can't we fix my sleep? But anyway, the solution for chronic insomnia is something called CBTI, so cognitive behavioral therapy for insomnia. There are a lot of online programs available. Most of the time, CBTI is delivered by psychologists, but even if you don't have access to a psychologist, there are many online programs available provided by very well-trained doctors. And CBTI is something that you can even read books and do it, but not everyone is very diligent. I am not one of those people who can go through a workbook, write down your sleep diary every day in the morning, and then assess that and go through it. Yes, if you are someone like that, you can you can try that for yourself. But my point is, if you are feeling terrible that your sleep is not better because you've tried all those sleep hygiene stuff, I hear you, and it's not a problem with you, it's a problem with the solutions you've been provided. So CBTI for chronic insomnia. Next comes obstructive sleep apnea. So that is, again, like I said before, you need a sleep study. So if you are not getting good quality sleep, now, do you necessarily need a device to tell you whether you're getting good sleep or not? No, not always, because sometimes some of the devices may not be very accurate as well. But if you feel rested when you wake up in the morning and you are getting about 6.5 to 7 or 8 hours of sleep every night, you are fine. But if you don't feel rested when you wake up, even if you've spent a lot of time in bed, then definitely that is something that needs to be addressed. Sleep is extremely important for brain health, not just for brain fog. So solutions, as I said, one was food, the next is sleep. Another important factor, because some of you have very severe brain fog or you're going through long COVID, and your doctor tells you, oh, you need to exercise for 30 minutes every day. I mean, didn't we know that already? But some of you have such severe fatigue that you're not able to do that. And you end up feeling terrible because you couldn't do and this is particularly so for many of you who are very physically active. Let us say you were very physically active before COVID, and you had a COVID infection, and then with long COVID, you're not able to perform physically in the, whatever particular sport you're doing as you did before, and you feel terrible. And that is when you need to be a little kind to yourself. So this is a technique that comes from the world of chronic fatigue, people who've got chronic fatigue syndrome. It's called pacing, PACING. So pacing is, number one, you need to look at your day and schedule your day depending on how much energy you have. And this is not just physical energy, it's also mental energy. So don't schedule 20,000 things into your calendar. Give yourself the space and the time and the permission not to do everything all the time. So let us say before you had brain fog, you could do 10 things in a day and multitask and everything. But now you feel you're not able to do that. It's okay. The brain fog, very likely, if it's an acute thing, will go away. But give yourself the permission not to do too many things together. Learn to say no to a lot of things. I know some of us have that challenge. We find it difficult to say no because you're good at this, you're good at that, you're a fantastic cook and you love to bake. And so someone or the other will tell you, can you do this for me? And you keep saying yes, yes, yes to everything. Maybe it's time to say no to a few things. So pacing is important. And I talked about food. The other big thing is nutrient depletions. So for nutritional supplementation, ideally, yes, you do need to get your labs checked to know whether you're deficient in iron, B complex. Now, B12 test is available anywhere in the world. Vitamin D test is also extremely important to maintain optimal levels of vitamin D. And optimal level is not just in the normal range. For those of you who use nanogram per deciliter, it is between 40 and 60 nanogram per deciliter. And those of you who use the Canadian units, multiply that by 2.49. So just being in the normal range sometimes is not enough. You need to be in the optimal range. And can you get all the vitamin D from only sunlight exposure? No, that does not work for everyone. And the thing is, I'm not going into vitamin D, but the important thing is how much vitamin D should you take? It depends on what your levels are. So it's important to get a blood test done and take the appropriate dosages. Some of us have a genetic variation in vitamin D receptors, and we may need a higher dose. I am one of those people, so I need a higher dose of vitamin D every day to maintain in the optimal range. Daylight exposure is very important from the perspective of your body's biological clock. but not necessarily to get enough vitamin D. And daylight exposure in the morning, particularly daylight falling on your eyes, is important for your sleep as well. So those are the supplements. The next is iron deficiency is very common as well for many people. You need to know the right test. So just checking a CBC, your hemoglobin levels will not tell you about iron deficiency, because by the time your hemoglobin falls, your iron stores have been depleted for a long time. So you need to get the right test, the serum iron, ferritin, transferrin saturation. So those are important. Your doctor should know, and you can ask your doctor, I want the detailed iron test, not just the CBC and the hemoglobin. That alone is not enough. So ferritin is your iron storage, but ferritin is also a marker of high inflammation. So if it is very high, you need to talk to your doctor to figure that out. It's not always only ferritin and hemoglobin will not do. So that is important to know. Next is B vitamins. Now, with some of these vitamins, magnesium is another big one. Doing a magnesium blood test will not tell you how much magnesium you need, but you can take magnesium to what I call bowel tolerance, because if you take too much supplemental magnesium, you can develop diarrhea. So when you develop diarrhea, you know that's too much magnesium, so you need to cut down the dosage to somewhere where you don't have diarrhea. Magnesium, vitamin D3, multivitamin, iron, these are extremely important. Another big one is omega-3 fatty acids. And ideally, you need to measure your level of omega-3 fatty acids. It's a specialized testing available in most places in the world. Then you'll know exactly how much of EPA and DHA you need. And the omega-3 fatty acid test actually looks at the levels of your omega-6 and omega-3 ratio, and also how much trans fats you have. Recently, a patient of mine, she was horrified to know how much trans fats she had in her blood, because she's not someone who eats unhealthy stuff, because trans fats come from a lot of processed food and packaged food. She said, I don't eat any of that. And we couldn't really figure out where the trans fats came from, and her omega-3s were lower. So I said, okay, let us focus on getting your omega-3 up and repeat the test in 3 months' time, and we'll probably figure out. So this is something that may come as a shock to some of you when you do the test. When I did my omega-3 test, and I've been supplementing with omega-3 for forever, I thought, I'm supplementing, I should be good. I found out that my DHA level, so DH is, it's important to remember, it's for the head, brain. So H is for the brain. So there are two of them, EPA and DHA. So I had lower DHA levels than I wanted. So obviously I've added a supplement which has more of DHA. So that is a little bit about, and I am going to create a document on supplementation. Some of the other supplements are some of the anti-inflammatory supplements. And again, for brain fog, there is nothing specific that is like, just take some curcumin and your brain fog will go away. No, I cannot make such claims, because it's different things. As you've realized already, I've talked about so many different things. It depends on what it is, because if it is your thyroid that is not working well, then obviously taking curcumin alone is not going to solve your problem. So some of the natural anti-inflammatories are curcumin, bromelain, boswellia. These, and you need to get the high quality ones, because as you know, in the supplement world, sometimes quality, and if you are my patient, you know that I have asked you, please don't send me the pictures of supplements, because I have no way of knowing anything about the supplements unless those are the ones we use in our practice. So curcumin, sometimes you need a higher dose, 1500 to 2000 milligram, and each capsule should be about 500 milligram of curcuma longa. So you need to read the label very carefully, because sometimes it will say it contains turmeric. So turmeric is this yellow spice that is used in Indian food and dal and things like that. Turmeric is not curcumin, the supplement, which has anti-inflammatory activity. The supplement should contain 95% of curcuma longa, and it needs piperine, which comes from pepper, for absorption, because curcumin is not always absorbed very well. So Will you get enough curcumin by just adding some turmeric to your milk in the morning or something? No, not the anti-inflammatory levels I'm talking about. So that is where the therapeutic supplement levels come in. And so moving forward, you will receive an ebook which will contain all the stuff that I've talked about, but I have not, that the ebook does not contain details about supplementation. I'm in the process of creating another ebook about supplements, but I haven't created that yet, and I don't know when I'll create that. And here I will pause. If you have any questions, please feel free either to raise your hand and I'll unmute you, or you can ask in the Q&A box at the bottom of your screen. And thank you for the thing about CBTI. Yeah, I have made it a point now to talk about CBTI whenever I talk about sleep, because I think very often CBTI is not mentioned when people talk about sleep. It's always sleep hygiene. Okay, so I don't see any raised hands or questions. So summarizing all the things that I talked about, first is what are the conditions where brain fog may be a part of what you're experiencing. One of the commonest ones nowadays is long COVID. It could be an autoimmune condition. It could be a hypothyroidism. It could be a hormonal problem. It could be food sensitivities. It could be nutritional depletions, or it could be some stealth infections. Those are kind of like deeper down, deep dive. So those are the commoner ones. Then what are the strategies? Some of the ones I mentioned. One is pacing, like be kind to yourself. Don't imagine, I mean, don't feel bad if you're not able to perform the same way that you did before you started experiencing brain fog. And if it is an autoimmune condition, definitely managing the autoimmune condition better, which may involve in pharmaceutical medications as well as lifestyle changes. Both of those. If you're not sleeping well, find out why. Is it because you think you don't need sleep, or is it chronic insomnia? And you can get the appropriate strategies for that. Then nutritional supplementations, I talked quite a bit. And most importantly, if there's just one thing you want to go away from this webinar with, I would suggest is look at how much protein you're eating. Most people don't eat enough protein. Even those of you who eat meat and fish, you are not eating enough protein every day. So you need to calculate, depending on your protein requirement will depend also on your physical activity. But if you are just looking at an average amount of protein, it is usually 1 gram per kg body weight. So if you weigh 60 kilograms, which is about, so if multiplied by 2.2 will give you the numbers in pounds. If you weigh 60 kilograms, you need 60 grams of protein a day. One egg is about 7 grams of protein. So now you understand how it's not easy to get enough protein. And if you're vegetarian or vegan, you will need a protein supplement. So food is a big one. So after you have, I mean, a lot of these things, like I said, you can do for yourself. After a lot of these things, you still feel you need more help, feel free to reach out to your healthcare provider. Some things like sleep apnea is not something you can figure out by yourself, because you're going to need a sleep study. And some of the hidden infections like or Lyme infection, sometimes Lyme is actually more commoner than we thought before, and not everywhere in the world. Some countries you don't have Lyme, but it is there in some countries. So sometimes it is forgotten. Another one is mold. So those are, again, other environmental toxins as well. So a lot of things are important. So there's no single cause for brain fog, and it's different for different people. So I'm going to end there. And if you have any questions, if you think of something later on, feel free to email me at info at drkarmd.com, info at drkarmd.com. And I usually do respond to my emails. Thank you. Thank you very much. And I really appreciate all of you spending your time here with me. And I do hope it was helpful. And in the future, if you have any other topics that I should cover, because I'm always trying to find out what it is that bothers you rather than what it is that I want to tell you. Thank you very much. Bye now. Thank you. Thank you. I really appreciate your kind words. And see you next month once again. So you will receive a recording of this webinar and feel free to share it with others. Bye.